Good afternoon, everyone. My name is Maya Luria with TMC for Seniors. We are going to be continuing on with our Going Beyond Survivorship series. Today, we'll be talking about Beyond the Diagnosis, the Power of Cancer Rehabilitation. I have Dr. Sara Parke here with me. Dr. Parke is with TMCOne. She is a cancer rehabilitation specialist. And Marija Zaruba. And Marija is a physical therapist over at our TMC Outpatient Therapy. Welcome, ladies. How are you today?
Doing great. Thank you for having us.
Good. I'm going to go ahead and put your PowerPoint up. You do have an online audience that's watching from home. So if you are tuning in from home, please feel free to enter any questions into the chat and I will ask you afterwards. I'll let you go ahead and get started.
Thank you, Maya. All right, welcome everyone here and online. I'm Dr. Sara Parke and I'm here with Marija Zaruba, and we'll be talking about the power of cancer rehabilitation. So as Maya said, Dr. Zaruba is a TMC employee here. She's a certified lymphedema therapist and physical therapist. And I'm a TMCOne employed physician. I'm a cancer rehabilitation specialist. I'm also an assistant professor of physical medicine and rehabilitation at the Mayo Clinic and director of the Western region for Revital Cancer Rehabilitation, which is affiliated with Select Medical and Banner Health here in Tucson. I'm also a medical advisory board member for Jasper Health, which is a small startup. We do not have anything to disclose.
Is the microphone on? Oh, it's not working right now.
So we'll be talking today about the who, what, when, where, and why of cancer rehabilitation. And Dr. Zaruba will also be sharing some of our success stories. We should have plenty of time for questions at the end, so we'll welcome those, just as Maya alluded to. We also won't be addressing anyone's personal health information, so if you could generalize your questions about those types of things, we'd appreciate it. Or you're welcome to make a consult appointment with myself or Marija. What is cancer rehabilitation? I get this question all the time, especially in a social context. Are we out to dinner with friends and they'll say, what do you do? Say, I'm a cancer rehab doctor. And they say, I'm sorry, a what? And, usually I explain it as medical care that helps people prepare for or do well during and after cancer treatment. Our goal is to really optimize your overall function and quality of life from a mind, body, and spirit perspective. And the program is completely individualized for you, depending on what your impairments are and what your goals are. Sometimes I think it helps to explain a little bit about physical medicine and rehab as a specialty. Many people haven't heard of it before. And it also comes by other names: rehab medicine, physiatry, PM&R. You may hear any or all of those. It's a specialty that was born out of war. Actually, it came after World War II. And the veterans came home with new traumatic brain injuries, amputations, spinal cord injuries, and they found that there were no doctors who were trained to really care for those patients specifically. And so our specialty is really designed to help people with life-changing illness or injury. And of course, cancer is one of those life-changing illnesses that certainly impact the body, mind, and spirit in the ways that those traumatic injuries can as well. So we fit somewhere in between orthopedics and neurology, doing neuromuscular and sports medicine type of interventions. So that's really kind of what PM&R is, or what physical medicine and rehab is. And I had the pleasure of doing my fellowship at MD Anderson Cancer Center in Houston, and it is the oldest and largest cancer rehab fellowship. And even so, it was only developed in 2007. So it's still a relatively new specialty. I'm the only cancer rehab fellowship trained physician in the state of Arizona, and had the pleasure of creating the first cancer rehab program in the state in collaboration with the Mayo Clinic. So that's why I have the faculty appointment up there. In my clinic, we see a huge variety of impairments. So it can be everything from chemo fog, chemo brain, to weakness, fatigue, deconditioning, those focal musculoskeletal issues. So sometimes it's shoulder pain, sometimes it's a trigger finger. And depending on your diagnosis and your treatment pathway, it can really vary quite a bit, and it can even evolve over the course of your treatment. So we take care of you as a whole person, kind of through and through. One of my favorite things about cancer rehabilitation is it's really a team sport. So it's my job to collaborate with the patient and family to understand what your goals are, what your impairments are, and then also create a team around you to help support those things. So we often refer to therapists, so that can be physical therapy and the subspecialists therein. So some physical therapists like Marija are certified in lymphedema. There are others who do pelvic floor therapy, some who do neuro, some who do sports or ortho-related concerns. So depending on what your impairments are, there may be a physical therapist that's perfect for you. Similarly, we refer to occupational therapy, and again, there are subspecialists there. So there you may need a hand therapist or someone who specializes in cognition. So depending on what your impairments are, they're, again, different players on your team. Speech language pathologists similarly do a variety. So of course, they do speaking problems like aphasias and things like that for people who have brain injuries, but they also do swallowing evaluation and swallowing treatment, and they do cognitive, so chemo brain and brain fog from chemotherapy can be treated by speech language pathologist. I partner with nutritionists, exercise physiologists, trainers, social workers, psychologists, and often your primary care team as well. Sometimes a patient will come to me with fatigue, and we find out, just like I did in a patient this week, that the reason they were so tired is because they had newly diagnosed diabetes. And so we got some laboratory work and found that, and I was able to partner with their primary care doctor to help get that treated. So sometimes it's a matter of specialty medical consultation as well. And then most importantly, we partner with your oncologist. So I'm married to a radiation oncologist here in town, and I often will joke with him that it's his responsibility to take care of the bad guys, kill the bad cells in your body, and it's my job to take care of the good cells and keep you going while you're on treatment. So that's kind of the partnership that we have. Cancer rehabilitation is not meant to be instead of cancer therapy, but in adjunct to. So as alluded to, depending on what your impairments and your goals are, there can be a variety of interventions that we have available. And Marija will get into some of the details. I think one of the most important interventions we have is exercise, and she'll explain why. But there's a lot that we can do for your body, mind, and spirit. And initially, it may be looking at, from a medical perspective, what is driving your impairment? Do you have back pain that's been pre-existing your cancer? Is it new? What is driving? Could it be possibly related to a metastatic lesion in your spine? Or is it just that you had a fall and now you have a compression fracture? So we have to figure out the cause before we can design the rehab program to treat it. So often I'll do a lot of diagnostic workup and specialty consultation initially, and then we'll expand into that team of the circle of providers that I shared. So cancer rehabilitation can happen in a variety of settings. We have an outpatient clinic here in Tucson, and Marija is also in an outpatient setting. So outpatient is just, like you go into your dentist office in a clinic, you're in and out same day. We also have rehabilitation services in the hospital, so PTs and OTs can come see you while you're inpatient. They can also see you at home. So there's home health therapists that have expertise in cancer care. We work with, as I mentioned, exercise trainers, personal trainers, home health agencies, a variety of settings. So depending on what your needs are, we have resources available for you. Bottom line is you shouldn't have to travel far. You already have enough on your plate, and we try to keep as much as we can local. Because I'm the only cancer rehab doctor around, sometimes I'll see patients from every corner of the state. I've seen patients from Yuma and Bisbee and Benson and all the way up to Flagstaff. And when I was at Mayo full-time, I would see patients from all over the country and even all over the world. But after the initial consultation, we try to do as much as we can in that circle in your local community. So when is best to start cancer rehab? I think broadly speaking, it's as early as we can, because it's much easier to treat impairments when they're new. When things are settled in, it's a lot harder. Not to say that it's impossible. I've seen patients who had breast cancer and had some lingering tenderness in the breast 10 years later. And we've been able to figure out what was going on there and treat it. So it's never too late, but as early as possible is my preference. Generally speaking, there's a model of cancer rehab that I like to follow. It's called the Dietz model. You'll see it on the right-hand side of the screen here. And we have the preventative phase, which is also called prehab, which Marija will describe to you. But our idea is that basically we assess your impairment initially, get you functioning the best you can, so that when you have the inevitable decline related to your treatment or your disease, it's not such a deep hole to climb out of. And we're able to kind of prevent things from spiraling out of control and getting worse over time. Restorative cancer rehabilitation is while you're on treatment, things might arise, you might have new pain, you might have neuropathy, and we're able to come up with some solutions and help minimize the burden there. Supportive rehabilitation is really designed for people who have permanent impairment. So something like lymphedema that we know is going to require maintenance over time, we can support you through that part of your journey. And then lastly, palliative. So there are 3 palliative physicians in my office, and I partner really closely with them. So even at end of life, it's appropriate to have rehab care, and Marija will kind of get into the details there as well. So we talked about location, but of course, especially in this day and age, finances are important too. And especially for our seniors who are on fixed incomes, it's really important to consider this aspect as well. So insurance does typically cover this kind of care. And I think that's important to know, particularly if you're able to see other medical consults, say from your primary care, they can send you to cardiology or pulmonology, they can send you to me. And it's a similar process, similar copay, all of that. From my office, I also try to refer to things that are in network for you. So most plans cover physical therapy, occupational therapy, speech, home health, so we can get a variety of services covered. Sometimes it's a little bit harder with nutrition and with psychotherapy. So if we're going to have out-of-pocket costs or things that aren't covered, we try to have discussions about that, the value of those services compared to the cost. So if you're unsure what you need, you can always ask for a referral to me and we can kind of go over everything. But also your oncology team is a great resource and often will know kind of the first step in that circle of who to send you to. So just make sure that you're not waiting too long. If you're suffering, please let us know. So we've gone through the mechanics, the who, what, when, and where of cancer rehab. So we'll hand over to Dr. Zaruba, who will get into the why. Thank you so much.
Thank you so much, Dr. Park, and thank you all for coming here and for everyone who's tuning in online. Again, I'm Marija. So why is this so important for seniors? So we know as we get older that it becomes a little bit more challenging. It takes a little longer to recover from illnesses and injuries. And then cancer itself leads to a slew of side effects and impairments, right? So essentially, cancer treatment and older age leads to more side effects. Dr. Park has already gone through just the many things that cancer rehab can address. So the bottom line is that rehab helps you stay strong and independent. We look at all of the targets that we can to help you if you're having issues in any of those domains. So why exercise? We already know now that cancer rehab is really all-encompassing. It's not just about one specialty. We're bringing together all the multidisciplinary approaches. But exercise is especially exciting. There's a lot of great research coming out regarding why exercise can be such a wonderful adjunct to anyone who's living with cancer. So you can see all of the things that it can improve here on the left. And I want you to look at the chart here on the right. So this is looking at research regarding physical activity and outcomes with cancer. Now, the highlighted area shows improved survival with post-diagnosis physical activity in breast, colon, and prostate cancer. Meaning if you've been diagnosed with any of these cancers and you start to exercise and perform physical activities, survival actually improves. Physical activity is also associated with a decreased risk of developing some very common types of cancer, and you can see that on the left part of the screen. And even if you don't see your specific cancer diagnosis on this chart, even more recent research, like a 2025 umbrella review, is showing good evidence that exercise post-diagnosis reduces all-cause mortality, reduces recurrence. It improves fatigue, which is consistently one of the most bothersome symptoms that people will report. It improves physical function, mental health, and quality of life. And I want to emphasize too that this is true even in folks who have never been physically active. So even if you weren't exercising by the time you were diagnosed, if you begin to exercise, you can get these benefits. This graphic here does a good job of showing just all the different domains that it can affect. It gets a little technical, but I just want to point out that exercise can improve the effects of chemotherapy, the effects of radiation, and the effects of immunotherapies. And it goes beyond that too. When we exercise, our body's innate immune response can improve. We're reducing inflammation, and it can also reduce tumor growth factors. It enhances the efficacy of cancer treatments is the bottom line. It can also improve blood flow to the tumor, which if you hear that initially, you might think like, well, that doesn't sound so good. But just know that if you have improved blood flow to the tumor, it means that those systemic therapies like chemotherapy, immunotherapies, they're going to be able to reach the tumor more effectively. So hopefully I've sold you on exercise, and you might be wondering, okay, can I just start exercising or do I need rehab? What's the difference? So it might be appropriate to exercise independently if you have already stayed active. The American College of Sports Medicine defines that as you do at least 30 minutes of moderate intensity activity. And that's, you're able to talk, but you're not able to sing while you do it, okay? At least 3 times a week for the past 3 months. And if you have no new physical impairments or concerns from your physician team. So let's say you've just gotten diagnosed, but you play pickleball frequently, and you're in pretty good shape. You should be okay to continue. Now, if you are experiencing new onset of dizziness or shortness of breath or anything like that, you definitely want to check in with your physician. You may want to consider formal rehabilitation if you have other health problems, heart, kidney, metabolic disease, such as diabetes, especially if they're not well managed. If you do not currently exercise, if you have pain, balance problems, or metastatic cancer, especially metastases to bone, we want to make sure that we're keeping you as safe as possible, especially in those long bones, your humerus, your femur, thigh bone, your tibia, right? And also your spine. Because exercise, we're loading you, right? You're putting weight through those areas. You might be doing movements that might stress the bone. So we want to make sure that that's done safely. And also if you are currently undergoing treatment or have recent surgery. So why prehab? Prehab improves all the things here that you see on the left, your post-op functional capacity. It reduces complications, and it can reduce hospital stays. So let's look at this picture here on the right. Let's say an individual is diagnosed with colon cancer, and they have a colectomy or a colon resection planned. And we know that there are going to be a lot of side effects from that, right? So let's say that individual is coasting at their current functional level, right? They may not be very active. They may have sedentary hobbies. So they're here. Then they get the surgery, and we can expect that there's going to be a drop in function, right? That's not surprising. It's going to be harder to move around. There's probably going to be pain. So they're going to get back to their functional level, hopefully, over time as the tissues heal, but it's going to take a little bit longer. Now, the black line on top shows someone who has gone through prehab. So maybe someone on their team has identified that, they're a little frail or they have balance issues, and that it would be good to get them a little bit stronger before they go into their surgery. So they start prehab with their rehab specialist. That gets them to a better functional level. They have the surgery, they're still going to have that drop, but it's not going to be as steep. And then as they improve, it's going to be a faster improvement with less complications. Prehab can improve chronic inflammation and oxidative stress in older adult patients who go through it, which of course we want for anyone who's going through surgery or cancer treatments. So think of it as building resilience in your body. Ideally, prehab also includes a multimodal approach. So not just exercise, but it brings in those other professions and areas of expertise like nutrition counseling, psychological counseling. And when you're working through prehab, your team will kind of know what kind of impairments to look out for. So we can kind of warn you or educate you so that you can advocate for yourself and stay safe. All right, so what about if you have stage 4 disease? Should you still do rehab? The answer is emphatically yes. There are so many benefits. Pain relief, we can train your family, stretching and strengthening, fall prevention, managing swelling. And research demonstrates that cancer rehab at the metastatic stage can improve quality of life, symptom management, and physical function. And again, a multidisciplinary rehab approach is ideal for reducing pain, fatigue, emotional distress, and bottom line, preserving your independence and dignity. Will it hurt? No pain, no gain, right? No. That we should never think in those terms in cancer rehab. So I've had too many patients tell me about bad experiences that they've had in PT in the past where, they get put through the ringer. Well, do 10 more of this exercise. It's not supposed to feel good, right? Suck it up. And that really hurts my heart because you should be listened to by your provider. So you know your body best. You should never feel sharp pain. Communicate with us. And if you have a skilled and empathetic provider, we'll be able to walk you through, are the sensations you're feeling within the norm of what we expect, or is something going wrong? Just last week, I was showing a woman how to do bridges, the exercise where you lay down and you're lifting your bottom up. And she hadn't done that in a long time. And she was unfamiliar with the sensation she was feeling in her thighs. She was telling me that it hurt. And after we dug into it a little bit more, we determined that it was muscle aches that she was feeling. So tight or weak muscles can feel sore or achy, but you should never feel sharp pain. All right, let's talk about some success stories. So Joe, 85, he was diagnosed with brain cancer, and after treatment, he developed issues with his swallow. And he had postural issues. So he was flexed forward and he was not able to stand up straight. So he was able to get in to see a speech language pathologist who worked with him on his swallow. He can now eat without choking. And he was also seeing a PT and he can stand up straighter as well. Marija was diagnosed with breast cancer and she developed a chronic swelling condition called lymphedema. So we worked together, got her swelling under control. We were able to train her on what she needed to do to manage this condition. So she got into some compression garments and had her routine down. And she also had numbness and tingling in her fingers after chemo. So she saw occupational therapy as well because she was dropping things, her dexterity was poor. And after working with both disciplines, she was back to work and she was playing the piano again. Bill at 73, so he developed fatigue and balance problems after chemo. So he saw his physiatrist, his PM&R physician, and they did some lab testing and EMG and determined that he had a B12 deficiency as a side effect from treatment. So with supplementation, his side effects improved and he was back to walking a mile every day. So take charge of your recovery is really the message that we want you all to internalize. You should not just live with it. Everyone knows that cancer treatment is not easy, but that doesn't mean that you have to accept all of the side effects. So keep a list of your symptoms. Bring your questions to your appointments with your doctors, especially if, has anyone ever gone to the doctor and had a burning question and then totally forgot it? Yeah. So when you have it written down, right, you can advocate for yourself. And most importantly, ask for that referral. We are here to help. Some resources. So these are all local resources here. I want to give a special shout out to TMC for Seniors. Maya, Jennifer, and team really do a good job of offering free programming with experts from the field in Tucson. So there's a lot of interesting information, and I'd encourage everyone, if you're not already, look at the calendar at upcoming talks. There's probably something that's relevant to you coming up. TMCOne PM&R, TMC PT/OT and Speech, Banner and Select Revital programs. Tucson Cancer Conquerors is a great local support group. YMCA Livestrong is here in Tucson, and they do some great exercise programming for folks. And then you can see more there on the right. And then here's some more resources from national bodies that you can look at. So they post all kinds of interesting information, patient handouts, and latest research that you can look into. Here are Dr. Parke's clinic details. She is outpatient only, Monday through Thursday, adults over the age of 17. And like she mentioned, she shares this space with palliative care and also orthopedics and general surgery. And then TMC Outpatient Therapy. So both of us are across the street off of Grant. So she is on Beverly. We are on Erickson Drive, so very close to the TMC main campus. We have many specialties, PT, OT, speech. We have a vestibular audiologist, and we see just the gamut of conditions, orthopedic, neurologic, balance and gait, vestibular, lymphedema, pelvic issues, and more. That may not be fully inclusive. All right, thank you all so much. Again, you deserve to live well with cancer and beyond. Stay active, stay connected, and stay strong. Questions?
So thank you so much. Marija, I had a couple of questions that came in, and for you too, Dr. Parke. One is it ever too late to start cancer rehabilitation? Let's say you finished your treatment months ago, but you still feel like maybe things aren't quite right.
Yeah, that's a great question. I think we both agree. Yeah, no, it's not too late. Yeah.
Okay. So you would still be eligible as far as receiving a referral for that. You think that shouldn't be an issue? Okay. Should can you get a referral from anybody, any of your physicians?
Yes.
To see you?
Mm-hmm.
Okay. Are there certain medications that may impact my experience during rehab?
Yes, there are. So if you are placed on immunotherapies or some of the aromatase inhibitors with breast cancer, a lot of those have their own side effects, and your team should be familiar with those. So it's definitely important for us to know what you are currently on, because it can impact anything from your balance to tendon pain to your sensation. So yes, yeah, it can.
Okay.
The other thing is we don't want to exclude anyone. So if you're, I kind of interpreted that question a little differently. Like if you're on narcotics for pain control, for example, you can still participate in rehab. We still welcome, your participation, and we can create a plan that is inclusive and understanding. And that's why I think It's really, I love being part of the team because I'm sort of able to be the interpreter between the therapy side and the medical side to kind of understand what's going on with you medically and help the therapy team know how to treat you best and safely.
Great. I just had another question, and it just sort of escaped me, but it will come back, I think. Can you, there is somebody that just asked a question regarding about counselors or therapists that specialize in working with cancer. Are there folks that can be referred for that, or in general? Okay.
Yes.
Okay. So that's good. That is good to know. I wanted to share with everybody sort of where, I know you shared, thank you for having that slide with the information about your locations. One of the things I wanted to share with everybody was your actual phone numbers. So I'm going to go ahead and put up Dr. Parke's number at TMCOne, which is 520-324-6290. And now let me go ahead and share outpatient therapy with Marija. It's 520-324-7005. Another question that I had was in regards to when you're doing your therapy, how long do you tend to see somebody?
It totally depends. Some people just need to get set up with a home program and some training, and they are good to go. Other folks require much more attention and time. So it can really run the gamut. It's based on what you need.
Okay, great.
I usually tell patients when they ask in clinic, you'll have an initial assessment with the physical therapist, and you'll tell them your goals, and they'll give you an estimate of how long it's going to take. But as you evolve and as you're making progress, it might be faster or it might be slower, but you'll know it all the way along. Yeah.
Okay, and you really work very collaboratively with their oncology team, I assume, and maybe their primary care physician as well, Dr. Parke?
That is critical. Before I see someone for an initial consult, I spend a lot of time, like an hour, few hours going through their medical record. I get as much information as I can from the oncologist and your other specialists, whether it's your neurologist, your urologist, your cardiologist, and I try to understand kind of everything that's happened with you so that when we see each other, we can kind of just dive right in and I really understand what's going on. And then partner with them afterwards as well.
Yeah, really building that full picture of every single individual.
And Marija, I know as a lymphedema, somebody who specializes in lymphedema, can you share a little bit about what that experience is like for somebody who might not know what happens? What does that look like when you come to see you?
Definitely. So if someone's experiencing lymphedema, there are 4 main treatments that we're going to go for. It involves exercise, teaching people lymphatic clearance exercises, because the lymphatic system is very dependent on movement to get the lymph flow. Compression, so I will either train you in how to do self-wrapping, I will help to wrap you, or we will get you into compression garments that suit your needs. Manual lymph drainage, so that's going to be hands-on work. It's a type of massage that helps to route the lymph and prevent it from collecting in whatever limb or body part. And then finally, education is really key. So people could expect to learn a lot about the lymphatic system. Most people don't know anything about it when they first come to see me, or their understanding is foggy. So we'll go through that. And I really work to get people feeling like they have self-efficacy and empowered to continue to work with this, because it is a chronic condition.
Great, thank you. The last question, somebody is asking about printing the slides from home. You wouldn't be able to print them from home, but if you give us a call in the office, we'd be happy to email you the presentation so that you have copies of those slides. Please give us a call in the office at 520-324-1960. I want to thank you both so much for being here. I'm going to wrap up with our online audience, and I'll turn it over for you for any in-person questions. Thanks for being here. Thanks again for joining us today. We hope that you'll come back. We've got some more of our survivorship series going on all through the month of October too. Our next talk for the survivorship series is going to be on Thursday, October 9th at 10 a.m. And that is emotional first aid after a diagnosis. What now? That'll be with Carrie Reeves over at the TMC Health Cancer Center. If you're interested in that class, please give us a call. Our phone number is 520-324-1960. I also just wanted to quickly share that we do have a new walk that is going to be starting in October for the month of October called Going Beyond, Surviving, Fighting, and Thriving. It is a community walk that we are that we're partnering with the Meet Me Mondays crew from Beyond. And we would love for everybody to come out, as we know that cancer affects our families, our friends, and our entire community. If you're interested in learning more about that, please give us a call in the office again. We'd be happy to share that information with you. There will also be a resource fair on that Monday, October 6th. In the evening, we'll be over at Corbett's on 6th Street. So please feel free to give us a call, and we'll provide you that information as well. Thanks so much. We look forward to seeing you again soon.